Bioidentical hormones. Are they safer than synthetics? Hi, I'm Dr. Jennifer Taylor, and I'm here to talk about this very controversial subject. You know, reading about bioidentical hormones and maybe talking to your doctor about them, I think there's some misconceptions. You know, as we go through our stages of life as women, we start to feel some things that may not be so great. You know, the hot flashes, the mood changes, the weight gain, all those things can really wreak havoc on our lives. And, many of you have talked to your doctors about bioidentical hormones. There's pros and there's cons. And really, when it comes right down to it, there really is no difference between the hormone replacement therapy like Premarin and preparations like that and bioidentical hormones. Yes, bioidenticals can be created just for you according to whether it's blood work or a saliva collection. All those things, do make a big difference, especially to women that are really suffering. And sometimes preparations like Premarin that aren't necessarily geared towards, helping things on a very individual basis do help as well. But are you just delaying the inevitable? The Mayo Clinic actually showed that as far as over a 5-year time frame, there really is no difference to how the body responds to whether it is the FDA approved kind of preparations or the bioidentical hormones. Both of them can cause heart problems after 5 years. So really, being on bioidenticals or other forms of HRT aren't necessarily good for you after that 5-year mark. So delaying the inevitable, I think, is really what's occurring because, you start risking some health problems afterwards. So once you get off of those, or your doctor says, okay, let's wean you off of these, a lot of times women find that all the same symptoms come right back again. So why not start off with trying to figure out what your body needs? We shouldn't have the hormones as we did when we were 18 and 21 years old. I know it sounds wonderful and it makes you feel great. It's kind of like a honeymoon period after you get started on these. But, you want to make sure that you go through this whole process, easily. And really what it is looking at diet, looking at possible supplementation to help your body do exactly what it needs to do during these stages of life. And adding in something from the outside in that actually manipulates the way your hormones function or adds more hormone in sometimes can not only cause damage, like has been shown in many, many studies, that it can cause a lot of serious heart problems, but it can also lead to things like cancers, like endocrine type cancers, which is, breast cancer, uterine, cervical cancers. All these things can be caused by adding in hormones from the outside in that aren't innate to us. So come and talk to us. We really want to be able to help you out with that. We can talk from a very individual basis to make sure you get to where you want to be. And join us on the 21st at 6:30. We're going to be here and we're going to be talking about that. We're going to have wine, chocolate, and cheese.